Question 50. You're a charge nurse on a busy med-surg unit. One of your patients is 72 years old, male patient. They have history of CKD and they're currently experiencing severe hyperkalemia. So that's your first patient. Another patient is 58 years old and post-operative from bowel resection, showing signs of hypovolemia, right? Then your team includes an RN, LPN, and nursing assistant. This is a delegation question. You guys know NCLEX loves this type of question. How should you delegate the care of this patient to ensure safe and effective management? Okay, hey, assign the RN to hyperkalemic patient for continuous ECG monitoring and administration of medication. Assign the LPN to administer IV fluid to the hypovolemic patient and have the nursing assistant assist with ambulation as needed. B, assign the LPN to hyperkalemic patient for ECG monitoring and the RN to hypovolemic patient for IV fluid administration and have the nursing assistant record intake and output for both patients. C, assign the RN to hypovolemic patient, assign LPN to give medication to the hyperkalemic patient and the nursing assistant to assist with daily living. And D, assign RN to manage both critical patients, the LPN to administer oral medication as needed, and the nursing assistant to monitor vital signs of all patients. So yeah, I'm trying to explain why A or D, right? We're stuck between A or D. So A makes the most sense, but I'm trying to explain to you why D is not even a contender. And I would understand why you think so. So A, let's think about it. A, you assign a patient that is obviously hyperkalemic to nurse, and then helping ask the patient that needs fluid, and then your nursing assistant can assist with ablation as needed. Are we good? So let me tell you, let me analyze D for you. So you would rather give two critical patients, right? Two patients to your RN and then administer and have the LPN administer oral medication as needed. Just the context of that question is incorrect. So here's the if you have a patient that you're caring for as a registered nurse, under no circumstance. Now, what people do in their practice sometimes is different from the textbook, right? Under no circumstances would you have someone else administer oral medication to your patient, because why? They probably know nothing about their patient, the history. Why are they giving this medication? What should they look out for? So that within itself is kind of like, why would you have the LPN give oral medication and you, the RN, take care of those two patients when the LPN can safely administer fluid? Fluid administration is not out of an LPN scope of practice. There's no reason why an LPN cannot safely administer fluid to a patient post-operatively. Does that make sense? So another patient 15 showing signs of hypovolemic. So if a patient were to go for surgery, right, there's some things that are expected from that procedure, and you wouldn't necessarily say it is unstable. Patient in pain, patient showing signs of hypervolemia, right? These are expected kind of signs and symptoms for a patient out of surgery, because when you get a surgery, you're prone to, losing blood, all of that, right? So this patient is stable enough for an LPN to care for. There's nothing on here that says they're having, respiratory depression or they're going through anything else that shows that they're unstable. This patient needs fluid, and all you got to do is start an IV. They probably already have an IV and plug in fluid. And I'll be damned if this was in a hospital scenario and then two nurses, myself and LPN, and then we have two patients, and then my charge nurse says, oh sugar, just go care for those two patients, and then just the LPN can just sit and whenever you need to give an oral medication, they will do that. That don't even look like a safe assignment. So remember the context of this question. The charge nurse, right, is the one assigning this patient. You as a nurse, you're not the one delegating, okay? This is not a question where you as a nurse, you're delegating what to do. So this is a charge nurse that is making an assignment, and he or she is deciding what patient should I give to who, okay? Because I think some might be mistaken. So you are the charge nurse on a busy med-surg unit, and then you have those patients. So how would you safely assign those patients to your staff? That's the context of the question, okay? The answer is A, and I'm gonna pull up your rationale. Now, this is you as a registered nurse. You're working in the ER. You have 4 patients, right? They arrived simultaneously. One is 65 years old and they have potassium level of 7.0. EKG shows peaked T wave. And another patient is 40 years old. They have sodium level of 120. They have altered mental status. Another patient is 50 years old with calcium level of 7.0. They're positive for Chauvinistic sign. And your last patient is 30 years old with magnesium level of 1.0. In which order should you prioritize assessing this patient? So you have all these 3 patients. What would be your priority? How do you care for this patient, right? So A, patient with hyperkalemia, and then patient with hyponatremia, and then the patient with hypokalemia, and then hypomagnesium. B, hyponatremic. Well, you guys can read. It's a lot. You guys can read. We're stuck between A and C. So if you're gonna say, okay, the first patient I need to assess is patient with hyperkalemia. Next patient, hyponatremic or hypocalcemic. Okay, I'm gonna pull up your rationale and then we can talk about it. Okay, so we do know that potassium is very, 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 very important because of the risks for your cardiac arrhythmia, such as peak T wave and things like that, which the patient already has, right? So that's our priority right there. But the next person that you want to rush to will be the patient with that low sodium level. Okay, you're working in an intensive care unit with a team consisting of an RN, LPN, and a nursing assistant. One of the patients is 75 years old female with severe hypomagnesium and history of alcoholism, and they're requiring IV magnesium sulfate. And that patient is an 80-year-old male with hyperkalemia, altered mental status, right? Requiring hydration and monitoring. How should you delegate to ensure safe and effective care for this patient? This is a delegation question, so make sure you read very well. Remember, we already have a question like this. This is very similar to the last question that we had. If you guys read your rationale, you guys will have no problem answering this next question. And this is just food for thought. Whenever you're studying, especially practice question, always read your rationale to understand why A or B is incorrect or A or C is correct, okay? Very, 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 very important. That way you can come across a similar question on your test, on your exam, and you can use the same rationale to rationalize why the right answer is the right answer and why the wrong answer is wrong. A, okay, so we go with this. So just the context of this question, you have a patient that needs IV magnesium, you have a patient that needs IV hydration, right? And you have a nurse and an RN, a registered nurse and an LPN on the floor. So which one would you assign to each, right? Obviously, you want to give your RN the patient that needs magnesium and then have your LPN care for the patient with hyperkalemia, because all they need to do within the context of this question is give an IV fluid, okay? The only thing you need to figure out is who should do what in this situation. Let me pull up your rationale, okay? You're a charge nurse on a busy unit. See a lot of delegate question, okay? Because you need to know, okay? You have 4 patients under your care. One is hypernatremic. The other one is hypokalemia. Oh my God, what is hypo and hyper? The third one is hyperkalemia. And the last one is hypomagnesic. How would you care for this patient? Kind of similar to the one that we did in 51. So you're working on ICU and one of your patients is 60 years old male and they have severe hypovolemia, right? And they require aggressive fluid resuscitation. Your team includes an RN, an LPN, and a nursing assistant. How do you do? The first answer option that I saw is D. So that's what we're going to start with. So you would assign your RN to initiate fluid restriction, assess the patient response to treatment, and then have the LPN administer medication as ordered. Even if this is not an ICU unit, is no reason why 2 people are caring for 1 patient. one person can do it. Okay, so let's remember that. Yes, your nursing assistant can monitor vital signs, but there's no reason why your LPN is administering medication for that same patient. The next thing I see is B. B is not. Please don't you ever think the most qualified person to care for a patient would do the listing in this scenario. So B says hire and monitor vitals and assess response to treatment, and then the LPN does the aggressive fluid resuscitation. No, please. Okay, always think of priority. The right answer is C. It is definitely C. You want to assign your RN to initiate the fluid resuscitation, closely monitor the patient, help and assist as needed, and then the nursing assistant to record the input and output. Okay, which of these following tasks safely delegate to a nursing assistant in the care of patient with hypokalemia? A. Monitor patient for signs of tetany. No. B. Administer oral calcium. C. Check vital signs. D. Educate patient. E. Assess the patient. F. Report any complaints of muscle cramp. C and F. Yes and yes. So for this question, I decided to do fill in the gaps because you could get questions type. You could get a type of question like this on your NCLEX. So this patient is with hyperkalemia, and the right answer is A. So first, in a patient with hypernatremia, administering hypotonic solution like half normal saline can rapidly correct serum sodium level without risk of complication. True or false? Okay, let's break it down. If your patient has hypernatremia, the best solution to help correct that would be hypotonic solution. Okay, if your patient is suffering from hyponatremia, and then you give hypertonic solution, right? So now this question, you have the right solution, right? This patient is hypernatremic, and then the right solution to give them is hypertonic, but can you give it rapidly? A patient with CHF is experiencing worsened shortness of breath and has a weight gain of 3 kg in 2 days. Which of the following actions should the nurse take first? Administer diuretic as prescribed, educate the patient about fluid and sodium restriction, assess the patient lung sound and oxygen saturation, prepare for emergency intubation. E. Increase the patient's supplemental oxygen. F. Contact the healthcare provider for further order. Yes, I see a lot of C. Assess the patient's lung sound and oxygen. That would help you determine the severity of the fluid volume overload and the respiratory status, okay? And that would definitely guide your intervention, okay? So C. A patient with acute pancreatitis is at risk for developing hyperkalemia. Which of the following signs and symptoms should the nurse monitor for? A. Numbness and tingling in the extremities. B. Positive trousseau sign. C. Hypertension. D. Bradycardia. E. Muscle cramps and spasm. F. Prolonged QT interval on EKG. Select or apply. So here on page 51, you have your hyperkalemia and hypocalcemia. And not only do I have it on your list of abnormal EKG findings, I also have what it would look like on the reading for you, just in case you get it as a picture, right? For patient with hypocalcemia, you're going to have QT prolongation, okay? And for patient with hyper, you're going to have QT shortening, okay? If you have hypocalcemia, you're going to have QT prolongation. So opposite. Does that make sense? Hypo, QT prolongation. And for your hyper, it will be QT shortening. The right answer are A, B, E, and F. Okay, the patient with history of hyperkalemia asked about dietary changes. Which of these following food should the nurse advise the patient to limit, right? So they are basically asking you which of these food are high in potassium. Okay, is banana high in potassium? White bread would be high in what? Whole grain bread, salt. Bless you. I love that. I love that. Potatoes. Is potatoes high in potassium? Potatoes. Yes. Apples. No. Salt substitute. Yes. Lean meats. No. So your answers would be A, C, and E. So you have a patient with severe diarrhea and they're showing signs of hypovolemia. Which of the following actions should the nurse take first? What would you do first? Would you administer oral rehydration solution? Would you start an IV fluid infusion? Would you measure the patient's urine output? Would you check the patient's blood pressure and heart rate? Would you educate the patient about the importance of hydration? Would you adjust the patient's diet? If you were to check the patient's blood pressure and heart rate, what would be a manifestation of hypovolemia? Low blood pressure and tachycardia. D. So you have a patient recovering from hypokalemia and asks about dietary changes to prevent reoccurrence. Which of the following foods should the nurse recommend? Bananas, correct, right? White rice. Oranges, yes, we all know that. Leafy greens, yes, we all know that. Whole grain substitutes. The right answers are A, C, and D. A patient with chronic kidney disease is at risk for developing what? Due to impaired renal function, the nurse should monitor for what signs and symptoms. In a patient with hypovolemia, administering a hypertonic solution is an effective method to reduce excess fluid volume. So if your patient has high fluid volume overload, right, what solution would help them get rid of the excess fluid volume? So it's false. If a patient has hyper, which means they have fluid in their body, right? And this question is saying, okay, we have this patient that has fluid in their body. Are we going to use an hypertonic solution to help them get that fluid out? This question is forced. In a patient as this, what are we going to use to help them get that fluid out? Diuretic. Let me pull up your rationale to help you. A patient with severe hypermagnesium is experiencing respiratory depression. The nurse has an order to administer IV calcium gluconate. Which of the following tasks related to this situation can be delegated to the nursing assistant? I love it. It's a delegation question. Monitoring respiratory rate and effort. B. Administering the IV calcium gluconate. C. Assisting the patient with positioning for comfort. D. Observing for signs of muscle weaknesses. E. Reporting any changes in patient's condition. F. Checking the patient reflexes. What can you delegate to your nursing assistants? Okay, relating to this situation, relating to this. Before someone starts arguing with me, CNA can monitor respiratory. You monitor respiratory for someone that is having respiratory depression. Someone that is a respiratory depression, you're gonna give it to your C. You're gonna you have to monitor their respiratory rate and effort because you're giving them a medication that, number one, they already have respiratory depression. Number two, this is the effect, the medication you're about to give them is going to have an effect on their respiratory rate and effort. So you know exactly what to look out for. So you do that as a nurse, okay? Now, they can definitely assist with repositioning, right? They can assist with positioning and comfort. Observe signs of muscle weaknesses. Okay, now, because I see D on the screen. Whenever you guys were doing CNA training and certification, were you guys taught signs of muscle weakness in patient with hypermagnesium? Do you guys have any modules on signs and symptoms of muscle weaknesses in patient with hypermagnesium? No, they're not qualified to do that. A CNA is not qualified to do that, okay? Report any changes in patient's condition. Yes. So you might have your patient, give them your IV calcium gluconate and run up to the nursing station or to what have you, to eat or something. And then they see your patient go south. They can definitely come and be like, no sugar, God forbid. That won't be me in Jesus' name. Nurse, whatever. Your patient is going haywire. Come here. God forbid is me. And checking patient reflexes. Absolutely not. So your right answer is C and E. And this brings us to the end of the live.